Hello everyone, I'm Dr. Suyash Kulkarni and today we are going to discuss a little bit about diabetes. Well, what do you understand by diabetes? Diabetes means increased blood sugar levels. Now, what are the signs and symptoms of diabetes? Well, person may suddenly gain weight, may suddenly lose weight. Second, may feel excessively thirsty. Patient may feel excessively hungry. Whatever you do, your hunger is not satisfied. Third, you may get up to pee multiple amounts of time, that is excessive urination. Generally, first few symptoms of diabetes are that the patient realizes that he or she is getting up at least a couple of times at night to urinate and disturb sleep. This is what leads the patient to testing for diabetes. Now, what are the other things you need to consider? In diabetes, we need a definition because just the single value of raised blood sugar doesn't make you or label you as a diabetic patient. You need to do your fasting blood sugar levels. If your fasting blood sugar levels are more than or equal to 126 milligram per deciliter, then it points towards diabetes. Also, there is a test called as HbA1c, which means the average 3-month blood sugar level, put it in a ratio. If this HbA1c value is more than 6.5, then you are more likely to be a diabetic patient. Now, what are the other important things what we need to know about diabetes? Well, the classification of diabetes, meaning type 1, that is juvenile type, or type 2, which is adult type. I will discuss these two topics later on in detail. But today, we are going to continue a little bit discussion about general diabetes. So, what are the important things you should take care of? Number one, you should have a lifestyle modification. If you are found to be diabetic, you need a lifestyle modification. What do you mean by that? First, diet. You should seriously monitor and regulate your carbohydrate content of your diet. Second, you should exercise. I'm not expecting you to hit the gym if you're a person who's having a sedentary lifestyle, but you can start walking. Start walking with at least 20 to 30 minutes per day. Walk like this for at least 5 times in a week. That's the beginning. Third, we may need certain drugs, but that, as I said, I will be discussing when I discuss about type 1, type 2. Now, with diabetes, there are certain problems which can occur in certain organs. The most important organs which diabetes hits are first, your eyes, second, your kidneys, and third, your lower limbs or lower extremities. You need, the moment you are detected to be diabetic, you should get your eyes checked. The possibility of diabetic retinopathy has to be ruled out. Please understand, if you take care of your eyes right from the beginning, you will have a good eyesight for a long time. Second, you have to do your blood sugar levels. Along with that, you have to do your renal function or kidney function test to see the condition of your kidneys, because diabetes affects your kidneys. And in the future, if your diabetes is not under check or not under control, your kidneys may get damaged and you may in future land up to be a patient who goes on dialysis. Nothing to be scared of. Not all patients go on dialysis, but those whose sugars are uncontrolled or else who don't monitor themselves have a very high chance of landing up in the future, say maybe 10, 15, 20 years from now, after they are diagnosed to be diabetic, to land up with dialysis. Another important point is your feet. You have to take care of your feet because a diabetic person has very less pain sensation or pain threshold. Sometimes they do not understand if they get wounds on their legs or their feet. So you should get someone to check your feet regularly, or you should check it daily before going to bed. For any other information about diabetes, please feel free to call me. I'm Dr. Suyash Kulkarni. Thank you.